Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
So, like I said, now glaucoma is something that has to be diagnosed at a very early stage because if you're coming at a very late stage, by then half of the vision is lost, then it is very difficult to retrieve the lost vision. Because once the vision is lost, we cannot do anything about it. Like for example, if you come to us in an advanced stage where 70% of the vision is lost, you have only 30% of the vision. We can only save the 30%. The lost 70%, there's nothing much that we can do about it. So glaucoma early stage can be detected if you're 40 years plus. It is important that you get an annual eye checkup done. When you're going for an annual eye checkup, usually we do a comprehensive eye checkup where we check your eye pressures, we check the eye nerve, everything is done. If everything is normal, then you can just come for a yearly checkup. In case you're already a patient who's having blood pressure or any diabetes or any systemic condition, again, it is important that you go for an annual eye checkup. In case you're having a family history, that means in case your parents are already diagnosed with glaucoma and they are under treatment, it is important that no matter what your age is, you please get your eyes checked. So early detection, early diagnosis of glaucoma is life-changing.
What are the risk factors for glaucoma and can it be prevented or slowed down with the lifestyle changes or medication?
Yes. So again, the preventive measures, again, it's important that in case there is already a family history of glaucoma, your parents, your siblings, if anybody is already diagnosed with glaucoma, there is a very high chance that you might be at risk for glaucoma. So in case you have any of your family members diagnosed with glaucoma, please do get your eyes checked, get your eye pressures checked. So usually along with the eye pressures, we do a scan known as visual fields. Visual fields is a scan which usually takes about 10 to 15 minutes. It's a non-invasive scan. On doing the fields test, we actually know that if you're having glaucoma or not. And in case you're diagnosed of glaucoma, usually the drops is the only remedy initial stages. We give this eye drop, which is normally once or twice a day. That usually keeps the pressure under control. Worst case scenario, in case the drops are not controlling your pressure, then we might have to do a laser. In case the laser also is not working, then we might have to do a surgery, which is very rare, but usually drops is the main treatment for glaucoma.
Agreed, doctor, what you said. How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
Okay. So in case you're having a family history of glaucoma, if you're 40 years and plus, you come once in 6 months to get your eye pressures checked. In case you're already diagnosed with glaucoma and in case you're having high pressures, normally the doctor, depending upon what your eye pressures are, the doctor usually calls you for follow-ups. It could be 1 month, 3 months or 6 months. But in case you're having a family history of glaucoma, you're not having any glaucoma, yearly once checkup is good enough.
So doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative and we believe your participation will greatly benefit the patients.